The other place we can have issues is your hip itself, right? The actual ball and socket joint. You can have, well, a lot of times I find that this has to do with just imbalance in the muscles and the fascial tissue and the balance of mobility and stability. So these glutes get too tight. These deep hip rotators are just too tight. So then, just like in our shoulder, we don't have this lovely ease of motion in your hip. So now we get extra strain as you try to do all of your life and go hiking and do yoga and be active and garden and do things. We're not getting enough motion. And so things get irritated. There's extra rubbing, there's extra friction. So you can get irritation in the hip joint socket itself, in the cartilage, overuse, degeneration. You have what's called your labrum, which is like a cartilage ring. So here in your hip, this ring of cartilage around the outside is called your labrum. Just sort of helps seat the head of your femur in the socket. So you can get wear and tear. You can have a traumatic injury to the labrum, a fall where you wrench your leg out. So essentially, you get like a tear in this cartilage ring, and you get then all the things that come along with that: inflammation, irritation, pain, tightness. So again, like our other injuries in our body, it can be a slow onset change that happens. It can be a traumatic injury, and it can run the range of what it needs to be repaired, right? Is it so severe that you have to have surgery to repair it? Is it something that you can just work on and treat conservatively with like physical therapy, exercise, body work?